On this episode of Athletic Training Chat, we have Lyle Danley, who has done a little bit of everything in his career, but more so recently has really dove into data science and the statistics and utilized that working in baseball, but now working within the military. And so I follow a lot of what Lyle has posted on social media. Data science is something that's super interesting to me, although slightly overwhelming. So this was as much for me to get an idea of even where to start with some of this stuff. And Lyle did a really good job kind of breaking it down and what the importance is and how to utilize it within the athletic training profession. So if data is something you're into, this is a great way to really get an idea of where you could potentially take it beyond just collecting it. As always, we are powered by Mueller Sports Medicine. We can't thank them enough for helping us out and the profession as a whole. Partnering with them on a few different initiatives. Our Throw a Lifeline, where they help supply the kit for some basic first aid emergency response stuff that we would get out to ATs when we can get it funded, and also now through Clinically Presco, the Mueller Recovery Tub. We've gotten 2 of those out thanks to a couple different donations and also just people listening. And just by listening to this and dealing with the ad that's coming up, it helps contribute. All the funds we get from that, we go directly into supplying these tubs and other initiatives. So we thank you for that. But without further ado, please enjoy this episode. Welcome to this episode of Athletic Training Chat. We are on with Lyle Danley, who is an athletic trainer, but the reason we've started connecting more and wanted to have this conversation is he has done a lot with data science, data analytics, and we'll get into talking that. And I've started to have a huge fascination with it, and honestly wish I could nerd out on it more and want to get there. But we've had a previous conversation with Greg Winkleman, who had done a data science boot camp and provided some insight. But Lyle, from what I've seen, just that he's posted and also in some of the roles that he's had, has kind of gone to another level with that. So we wanted to talk about all of those things and just what that looks like. But before we jump into all of that, wanted to turn over to you, Lyle, to fill in as kind of your background, and then if you could, kind of what took you down this route of data analytics, data science.
Sure. So my current role, I am a data scientist on the Preservation of the Force and Family program. It's a program that provides kind of a holistic set of services for special operators in the military. It's driven at U.S. Special Operations Command, and so it's actually administered through every major branch of special operations in the military. So MARSOC, USASOC, which is the Army, NSW, which is Navy Special Warfare, and JSOC, which is like Joint Special Operations Command. And then I work at Air Force Special Operations Command at AFSOC. And so I am the data scientist responsible within the physical domain. And what that means is the physical domain of POTIF is it consists of athletic trainers, strength and conditioning coaches, registered dietitians, physical therapists. And so I'm responsible for kind of aggregating and representing all of the data that comes from those labor categories. And so I push that stuff up to SOCOM and to COMAFSOC, which the commander of Air Force Special Operations. And then I also kind of in my role, kind of looking down and within the component, I try to answer ad hoc questions or provide context or provide tools to make life easier for athletic trainers and strength coaches and all the people that use these that have to record this data and put in these things so that we can ultimately represent ourselves well to like Congress and the folks
Sure.
who pay the bills. So that's what I do now. Um, I've been an athletic trainer for almost 10 years. I uh, did both my undergrad and grad school in Texas. Um, my undergrad was at Texas Tech. My master's degree in athletic training came from Texas A&M. And just like a, a quick background as far as places, I've worked in professional baseball as an athletic trainer, worked in Division One athletics as an athletic trainer, and then I took a role in the military and started out just like straight AT stuff. And um, while going from the traditional setting to the military setting, one of the big things is that um, on contract-based jobs and really on everything that works in the government, everything is based off of working 40-hour work weeks.
Sure.
And like you can flex that, and there's some like leeway with that, but especially with contracting, like the contractor, they get to bill for those 40 hours and they don't really get to bill for anything in excess of that. And so going from being in traditional athletics to a 40-hour a week job, um, I got really bored. And so part of my being bored was I got a second master's in data analytics, which I got that through the business school at Texas A&M. And with that, as I was getting that degree and I was working at Air Force Basic Military Training, we had at BMT in the Viper program scaled from 8 athletic trainers to 30.
Wow.
And our footprint really got big, comparatively, right? And as a result of that, the amount of patients that we were seeing obviously was scaling up. And myself and another athletic trainer, we were really dissatisfied with the mechanism by which we were keeping track of everything. And so between the two of us, we developed and then kind of quality controlled an outcomes tracker that we then educated on and then implemented among the 14 clinics that we had. And that involved a lot of coming up with common definitions of things and then making sure those common definitions of things were kind of briefed and educated to the people who are going to be filling out these forms,
Sure.
so that um, you know the the idea of the definition of like what makes a bone stress injury, which is like the big bugaboo in the military training environment. Um, the definition of what we're thinking in terms of what does advanced imaging entail, because really the standard of care in at BMT was if anybody has a suspected BSI, we're we're automatically getting an x-ray. So that's not advanced imaging. That's standard of care. That's what's written out. That's what everybody does. Everybody gets
Gotcha.
labs, everybody gets an x-ray. And so being able to tell them like, we want you to check the box for advanced imaging only if they get an MRI and an ultrasound or a CT or, those things.
Sure.
So like being able to get that stuff briefed out so that we had 8 different people who had their own set of expertise, their own backgrounds, their own kind of way of interpreting the body of knowledge, so that like it's a really fun but fine line of like, I understand that you may think that this is different because of what you have experienced and what your um, professional background is, but for the purpose of being able to like keep apples in boxes with apples and put oranges in boxes with oranges, I really need you to put yourself in the mindset of this is how we're defining it, and define it that way for me, please. And that's usually, if as long as you can help people understand and help them care about stuff, they do a really good job. Like at BMT, they did and continue to do a really good job with that. It's just finding a way to bridge the gap between like what I need this stuff for from the standpoint of like being able to report things in a bigger picture, and what people are doing on an individual day-to-day basis. And that's a big part of my job now. Except with BMT, it was 30 athletic trainers at 14 clinics, serving roughly 1,000 people a month. Scale that times, to scale that to, it's what it was you have between 35,000 and 40 people coming through BMT every year, and about 20% of them receive musculoskeletal care. So whatever that
Sure.
number is, sorry, I can't do Aggie math. 20% of 40, that's like, between 8 and 10,000, right?
Sure. Sure.
People a year. Um, and so scaling from that to where now we serve, AFSOC has 18,000 service members assigned, and I've got about 300 providers spread out between all of the components in 8 different wings, four of which are local, two of which are overseas. One's in Clovis, New Mexico, and then we have these geographically separated units that are kind of like our secret squirrels that are in different places all over the country. So it's a little bit more squirrel chasing, and it's a lot more kind of um, getting people on the same page. And like, it's funny because, like I said, I got into the data science stuff um, partly because I like the thing of being able to kind of get everybody on the same page and
Hmm.
taking problems that people have and kind of picking them apart and finding out what we can do to solve things, and that sort of thing. And it really, really goes against kind of what the perception is of people who do that sort of thing. Like,
Sure.
the old joke is like the difference between an introverted data scientist and an extroverted data scientist is the extroverted ones, well, they usually look at your shoes whenever they're talking to you, and the introverted ones look at their own, which is like the opposite of me. Anybody who's ever met me knows that I'm like a super social guy, right? So that's been kind of fun to break that mold a little bit and be somebody who's a little bit more like my I I end up spending a lot of time by myself nerding at the end of the week, because at the beginning of the week I'm constantly trying to like just talk to people and figure out and get
Sure.
context, and I have questions, and inevitably I go to the people who have the answers and say like, hey, you know, please help me with this because I don't understand. And just try to put myself in the shoes of like, listen, I'm the idiot in the room in a lot of cases because I don't get to do what you do every day. So help me understand what you're doing so that I can make sure that I'm putting that in the context as I'm representing these things to the people who make big decisions. So anyway, that was a long answer with a little bit of a meandering, but
You're all
I
good.
yeah, I've worked in the pro baseball, Division I athletics, military. I feel like for the first 8 years of my career, I was always doing some form of outreach, contracting, PRN, because athletic trainers don't make enough money to support themselves otherwise. And so I've done that. Uh, After right as I was finishing my second master's, I left Air Force BMT and spent a season doing sports science with the big league club in the front office at the New York Mets. And then shortly after that season was over, I spent a little bit of time, stayed in New York for about 6 months, and worked as a physician extender at Columbia University with a shoulder and elbow surgeon, which was so much fun. And I really, really like if I'm ever going to work as an AT again, it's going to be in that setting because
Sure.
I like that brand of patient care, and I like being able to sit with really smart people and learn from them. And I also like being on like the healthcare industry side of things. That really, really helped me as I came into this role, because I can have conversations with people where they're asking how we can represent things with metrics. I'm like, well, we already have something built in to the healthcare system as to how we can represent value. Um, it's called a value unit. And like, RVUs are things that everybody, like, that's how all hospitals do all of their things, right? Like that's how
Right.
they tell whether someone is working or not, basically. Um, and so that was really cool to be able to have that, to be like, they're like, well, we don't really know how to do this. I'm like, well, you don't have to for this particular thing. It's already being done. And we can just iterate off of that. So um, very, very grateful for all the places that I've worked and kind of gotten a little piece from everywhere, and the good, the bad, and the ugly. And it allows me to, as I've walked into this job, I feel really fortunate that I can kind of choose from those experiences and be able to like have a perspective that I feel very lucky to have the perspective that I have, because I've gotten to do a lot of different things with a lot of really, really great people.
Definitely.
Um,
It kind of ties into one of the questions, but also just to understand a little bit more of what you're currently doing. So I'm gonna kind of blend them all together. But you mentioned it sounds like you're kind of in the middle between the higher up reports and gathering all the data from all the
mhm.
ATs and strength coaches and physical therapists. What or how or some combination of them is determined on what you're looking at in terms of data coming in. Is it just, the strength coaches all kind of agree like, hey, these are the testing things we're going to look at. Here's how often we're going to do it, whether that be,
Yeah,
GPS data from training or force plate data or just straight strength and, other testing data from a physical side versus athletic trainers coming in, whether it's kind of return data like you said, outcome data. How does that all kind of come in? Was that all predetermined before you got there? Has there been a lot of conversations? And all this ties into one of the things that we talked about when we were setting this up, however not long ago that was, is just how do you approach these questions and figure out what actually is worth looking at, or
yeah.
data is great, but if you don't know what you're going to do with it, as you well know, or just collecting
It's
data doesn't
context,
mean
right?
much if you don't
Yeah.
do anything with it.
If
It's
you don't
just
have
it's just
anything to,
there, right?
yeah, if you don't have a reference point, if you don't have anything to like compare it with, or you don't have context through which to represent it, like it's meaningless. Yeah, no, I agree.
Right.
Um, so
Sorry, that was a
luck,
long question. However you want to break
no,
that down.
yeah. Well, and so um, I think that part is like it's a valuable question to ask, but I think we also spend a little bit of time making it harder than it needs to be because we keep trying to reinvent the wheel.
Sure.
Um, I'll just like say my experiences in traditional athletics, um, because and and, and I think you're going to get a different answer if you ask people who are from different parts of the world, honestly, because American athletics, uh, there is it's a very decentralized structure, right?
Okay.
So like unless you're like the XFL or the AAF is what it used to be, or like one of those these professional organizations that it's like one organization and everybody is hired within that organization and it's kind of very, very top down controlled, which the only
Sure.
ones that I can think of are the XFL and formerly the AAF. And I think US lacrosse is kind of that way, but I'm not super, or like professional lacrosse is that might be
Gotcha.
spun up that way, but they're very different from we how we understand like the NHL, the NFL, the MLB, and the NBA are. There's a certain amount of crosstalk, and because of collective bargaining agreements, there's certain standards to which organizations have to be held for
Right.
certain things. However, the level of collaboration and the level of like that infrastructure is very, very decentralized. So, like, my sample is only based off of what I've done in the history of my organization.
Sure.
And that's in college athletics as well. Like, we do have some shared mechanisms, right? Like, the Pac 12 had the CERMAP study where they had to put everything into a central EMR. You have these opportunities for voluntarily putting things into central EMRs and central clearinghouses.
Yep.
Like what the folks at AT still do with the, I don't remember the name of it, but they have like a central mechanism for putting everything in that the the oh, I can't remember his name now. Kenny Lamb, that Dr. Kenny Lamb kind of heads up like it's like the it's it's basically a giant voluntary EMR where with the purpose of collecting things for
Sure.
research. It's like an outcomes based network. Um, but for the most part, like we're not incentivized to do that in the US unless like we do that voluntarily or we're coerced to the way that some of these organizations like you in pro baseball you have to use a certain EMR and that EMR allows you to do kind of data pulls for yourself, but in terms of doing like a larger study and like a larger validation that isn't, you mean you got to go through an IRB process, and like it's a pretty big lift, and it's all controlled by the organizations. Whereas in like in Australia, they have a like a central
Sure.
sports, like national sports organization.
Yep.
In China, they have a national sports organization. In like, in Europe, a lot of the European countries have those set up that way, where because everything runs through one centralized organization, there's a lot more kind of vertical integration of that stuff. So, um, I say all of that to say that people at the university level and people probably in the professional realm, excuse me, we're all trying to solve the same problem, right? We're all trying to win games, and we're all trying to keep people healthy. But then how we define what it means to do that really can take a lot of different turns. And the other thing that we're fighting is we're also fighting um, leadership structures that, because they're so coaching driven and because they're so like coaching culture driven, that if you have a head coach that comes into a new situation at a big school, they can take some, like, you can have been working on something for 5 years and have these priorities with what you're collecting stuff on and really trying to move the needle, and you can have somebody come in and they can say basically, well, that's not important to me, so I need you to focus on the things that are important to me. And so being able to balance that and to be able to have that organizational support to be able to kind of weather that, um, and still provide a product that's going to be helpful to a new person who has new priorities, but also maintain that same infrastructure, that's a challenge. And
Hmm.
there's a few organizations that I've like been, I only know because I have friends who work there or that I have worked there, but I think they do a really good job of that. But I think overall, a lot of that gets lost whenever you iterate between front office staffs or whenever you iterate between coaching staffs. So, like, how we do that, I think we owe it to ourselves to be very collaborative and to talk to each other about that, and not to make everything like a super secret squirrel thing. But that's really, really hard in like the competitive environment that we live in,
Sure.
right? So that's like it's a whole thing. Um, that's me riffing on stuff that is not necessarily in my world right now. Um, I have it pretty easy because I'm told what to do. There's a directive that comes out of SOCOM that says these are the things that we measure.
Okay.
Um, we get to have some latitude because, like, my life at AFSOC is very different from someone else's life at MARSOC or at NSW, or each of the different components. So there's a little bit more latitude in how we're how we're being told to make that happen. But in terms of what we're measuring, big one is utilization. So utilization means how many people are coming, how much are we doing? So um, what are our numbers in terms of the number of events that we're doing? So how many group training sessions? How many appointments do we have? How many briefs are we giving? Like those sorts of things. And then tied to that is, within those events that we're doing, just how many people are coming.
Yep.
So, you know, I that in itself um, is not a very hard thing to capture, um, like in theory, but in terms of how it's implemented, that's where you start getting into challenges, because we're so decentralized and we've got so many, we've got 9 different wings all across the world, and everybody has a different set of access to things, and everybody's also dealing with a different, like every squadron or unit that they're in, they're going to have different kind of quirks and eccentricities about how people are showing up. So like, and whenever you're dealing with things on the order of like 8 sessions a day over 12 hours, and each of those sessions have 40 people showing up, like keeping track of that is a challenge if you're trying to do that by pencil and paper and then put it into a central system, which is what we're basically asking our folks to do. And we have a lot of people who do a few different things to try to capture that, whether that be they figured out how to scan scan their ID cards and put that in with a timestamp, or they'll have service members scan with a QR code and plug in their information, and that goes into like a Google sheet or an Excel sheet with a timestamp. Or sometimes it's if it's a smaller group, it's by pencil and paper, but everything from there gets put into a centralized system. And then from that centralized system, that's where I come and I
Okay.
pull what I pull and I separate it by however we want to separate it, whether it's keyed by the service member and where their affiliations are, or keyed by the provider and where they are. I spend a lot of time on that. And I spend a lot of time on it because it happens to the tune of like 40,000 people a quarter, coming through and having these, and utilizing our services
Yep.
just within strength and conditioning. I honestly can't speak as much to our full numbers within the sports medicine and the performance nutrition. And part of the reason is because theirs are actually a lot simpler because most of their stuff is one-on-one appointments.
Right.
Um,
Right.
and, it's just easier to keep track of. So utilization is a big one. Physical performance. So the SOCOM has directed that we have a physical performance assessment, and that really does a good job of being able to kind of see how utilization drives uh, where people are like normality wise, but then also see how utilization, like how much somebody comes, how does that drive how well they do on the test or how well they improve on the
Yep.
test. And every command is given the latitude to develop a different physical performance test that is really kind of set to what the demands of the career or the people that that are doing the things, right? So we have three physical performance assessments because AFSOC is unique among the rest of SOCOM with POTIF, where we serve not only the operators but also the pilots and the support staff, so maintainers and
Sure.
all of that. And so we have one test for the operators that is, obviously a lot more stringent because they are a lot more like their jobs are very physically demanding. One for the pilots because they have a different set of demands, and then one for the support staff because they have a different set of demands. And so those are already put together, and they involve some things that are like power based, some things that are strength based, and then some things that we measure on force plates. Um, I won't get into it because it's three different tests and they're each 90 minutes and there's three of them.
Fair
But
enough.
that's what we measure. And then we also have a holistic questionnaire that measures just like where someone's self-perception is of how confident do you feel with um, some of these things that we're talking about, whether it be how confident do you feel in making good choices with nutrition? How confident do you feel that your training prepares you for what your mission set is? And then that's also paired with with an insomnia severity index and a couple of other things. Um, and those are all based off of validated measures that we've put into one measure that we call, it was first done by the seventh group, which is in USASOC, seventh group special forces, but now it's done by us too. It's called the TPIQ, the Tactical Performance Index Questionnaire. So that's kind of another qualitative way that we look at those things. So yeah, that's what we use. Um, Whenever you talk about what you are like, once you decide what you're measuring, right? Like my job is data scientist, right? And I feel like what so much of what I do is like trying to make sure that whenever we are doing anything where we're representing information or helping people make decisions, we do it with a certain amount of scientific rigor. So at the end of the day, everything that I do falls around the scientific method um, in some way, right?
Mhm.
So define the problem, research the problem, implement an intervention, report the intervention, check our work, try again. Um, and so with our kind of implementation of a lot of these things, for me, it's um, the very first rule of anything dealing with analysis of data is garbage in, garbage out. So what can I do to what can I do to put checks on um, how we're collecting things and how we're inputting things into a centralized system so that whenever it's getting pulled out, I don't have to make assumptions. I don't have to impute missing entries. I don't have to account for, you know, differences in the way people understand how stuff gets put in. So collection of data and being on the same page with collection of data, or, you know, we don't have to say data, just collection in general, like that, there needs to be standards with that. And so that's actually like the first thing that I'm trying to get implemented kind of AFSOC wide is iterating on that so that everybody's on the same page with it. And then like once we have that, then determining how we're going to do some of these analyses and like how we're going to use the information that we have to try to represent some form of an answer. So what do you want? Do you want this in terms of, you know, dollar amounts? Do you want
Hmm.
this in terms of how it affects dollar amounts? Do you want this in terms of like how improvements are being made on a test? Like what do you want? And so that's where like really understanding the intent of stakeholders is important because like if I'm talking to a strength coach about utilization, really what we're talking about is how they're reaching the most amount of people possible and whether the things that they're providing are moving the needle in terms of how someone's performing or how someone is doing in terms of like their injuries or or their readiness or their ability to access care. Like that's what we care about with them. But if I'm talking about that with the commander of AFSOC, who he's the one who decides how the money is spent, and he's the one who decides what is important in terms of getting the pieces of the pie, I'm going to talk about utilization in a very different way because we're going to care about like how much money are we spending and how is that defining or how is that being spent and is there are we getting a good return on investment? It's the same thing as if I'm answering questions to the folks from SOCOM who ultimately have to answer to the GAO and Congress of, you know, are you spending the people's money well? Are you administering this program well on behalf of the American people, really? Um, and so the way that I answer questions to an HPA, a human performance advisor, they're basically like the person in charge of all the physical domain stuff at an individual wing. Like, how am I answering that to an HPA versus how am I answering that to a strength coach or an athletic trainer? Or
Hmm.
how am I answering that to like an officer? Like if Colonel Busk, who is our he's like our division chief, like or division office commanding officer. Like if he's asking me those questions, I'm not going to answer them the same way because like if I tell him about issues with um, how people are utilizing equipment, like he doesn't care. Like he cares, but it doesn't really care. Like he wants
Sure.
to know about the things that he can use to help us or that he can use to drive the mission forward. The same way that like if I'm having an issue with the way something's being calculated at SOCOM and I try to have that conversation with the strength coach, they're like, Lyle, how does that help me do my job? Because it doesn't.
Right.
So it's kind of taking and seeing the big picture, but then figuring out like what is the context of the conversation that we want to have here. So anyway, I feel like I've talked a lot
No,
about this.
no,
Like
it all makes sense. I just wanted to kind of bring it back to, more specifically, AT value has been something that's come up a lot. That's been a huge push
yeah,
by the NATA, data collection. And I'm not arguing against it. I think, again, if you aren't collecting it, then it's hard to really even start an argument at all, or,
yep.
put together a proposal or whatever it may
You
be. So, yes, you got to start somewhere.
Yeah, yeah. Everything that we need in terms of improvements in personnel, improvements in equipment, improvements in processes, all of that has to boil back to where are we and how does that relate to how everybody else is doing or how does that relate to best practices? And you can't have those conversations and be taken seriously if you don't have something to back that up on, right?
Right. And so that kind of brings me to a two-part question of, um, something I feel strongly about, but we'll hold that till we get to
I
the second part of the question. But
Yeah,
from
we
what you've
might end up
seen,
having the same strong feelings because I they're like we're nibbling around some stuff here that I think once we get into it, it's like I'm let me kick my soapbox out real quick. No, that I'm excited to talk about this because I hear this from ATs all the time, and I think that there are some big misconceptions.
what data, first of all, just in your experience of what you've seen, in multiple settings and kind of now, would you say, for somebody in the more traditional setting,
Yeah.
secondary, university, what do you think would be the most impactful data to go after? Just there's a lot of things you could collect, but what have you seen just in you being more involved with a lot of data that you think would be a good place to start? Well, that's kind of part one.
hmm Well, I think that where you can make biggest um, the biggest push and represent yourself the most is it all starts with standardized documentation and just being able to on an encounter level track and account for who you're seeing and what you're doing for them. So we have this healthcare system that's insurance based where everything is based off of doing things with codes like CPT codes.
Yep.
And I'm not saying that like the CPT codes and the diagnosis codes that come from ICD-10 are like the perfect and end all, but to start with, just being able to track and measure how many people am I seeing, what am I doing with them, and then ultimately over time longitudinally, like what's their what are their outcomes. So like if you're asking me the things that people need the most or like what would move the needle the most, it's a like standardized documentation that is accurate and meets the needs of the organization you're reporting to, and patient reported outcome measures so that you can move the needle or show how you're moving the needle on getting somebody better. And it doesn't have to be rocket surgery. It can be what's the name of it? Like just the score of like you ask them at the beginning of the day if 100% is normal and 0% is completely non-functional, what percentage are you at today with your knee?
Sure.
And if and you know if it's 50% is 50%, and then compare it to the other side and then just tracking that over time to show that you can make an improvement. um, that's a big place to start. And then tracking what you're doing because and the nice thing about doing things via the whole CPT stuff is that we can always fall back on CMS reimbursement rates and we can always fall back on how RVUs are calculated from those, and being able to represent that. If you want to do dollar amounts there. Where I think we start getting into trouble is whenever we start thinking that we can represent an ice bag as a treatment, or we can represent somebody doing electrical stim and just leaving them there as a form of like value. Like I will tell you that nobody who is providing any reimbursement in today's healthcare system, they do not care whether you put ice on somebody or not, and just put it on there and leave it. They don't care how many ankles you tape. Um, there, it's obviously a cost, and you need to be able to represent that as you're doing, your accounting and your budgeting. But I think we spend way too much time on trying to drill down on things that have very little value in today's world, and we spend a lot of time thinking about the like how we can show like the stuff that we're doing, that's kind of just what we've always been doing. And it's it's really really frustrating to me because like we just it's almost like a self-congratulatory thing where people will be like, yeah, we handed out 15 and pat themselves on the back, and it's like, well, you know, have you read the evidence on cryotherapy? Because I'm not an anti-ice guy, but I do like it has a place, and the
Right.
place is for pain mitigation, and that's kind of it. Unless you need to have somebody have something to do while you're doing something else, and then you can come back to them, sort of thing. And like,
Sure.
that's the purpose of passive modalities, in my opinion. And I think we spend a lot more time putting value on things that are passive modalities, and we're also being found out by that because ever since Therabody and Hypervolt and all of those folks started, um, manufacturing massage guns at scale, um, and gua sha tools are manufactured at scale. And we're putting the power into consumers to be able to get those things for themselves. And people buy foam rollers, and people buy these other devices that we used to keep in training rooms and hold on to and be gatekeepers for. And the more
Hmm.
we try to gatekeep that stuff, and the less we actually focus on the values that we can provide as like actual healthcare professionals, the more trouble we're going to have. And
For sure.
so that's, I mean, if you're asking what specifically to measure, it's the same thing that everybody else is measuring, right? Like you go to a PT clinic and you see what they're doing note wise. You go to a doctor's office, you see what they're doing note wise. They're not doing it. I mean, they're partially doing it so that they can contribute to the body of knowledge and the research if it's ever done and like that sort of thing. But they're also doing it so that they can get insurance reimbursement.
Yep.
And you look at what they're doing for that, and that's probably what you need to care about. Like from a fiduciary standpoint, how much value am I providing is really based a lot on that. And then thinking more in line of like, how am I serving the needs of my patients and the needs of their problems? You kind of got to put the epi hat on a little bit so you can think about things like injury incidents and prevalence. So, like, what's my most common thing that happens and why is it most common? Um, and that's also done via an EMR, in my opinion. So I think that that's why you use an EMR. But being able to have a conversation with a coach or a strength coach about, like we all see trends, right? Like we know that because they started doing this particular drill at this particular time of the season, there's more hamstring strains
Right.
or something. Like, I'm inserting an injury there. Um, but if you think about how it sounds if somebody comes up to you and says, well, yeah, it just seems like there might be something going on with this because there might maybe seems like there could be more hamstring injuries. Like that doesn't have any weight. But if you can say, like, here are the number of practices that we've had, here's the amount of time that we've spent on these other different drills. When we added this drill and that added this much time to practice within those spaces, we had 15 more injuries or 15 more hamstring injuries. And that changed the incidence of hamstring injuries from, X percentage per thousand to Y percentage per thousand,
Hmm.
and that's an increase. And it happened in the space of nothing else changed, but we added this. Like that becomes a lot more powerful to have those kinds of discussions. Um, and that's just thinking from like the injury mitigation, injury
Oh, for
prevention.
sure.
I hate, but like you can think about it from those terms, thinking about it and figuring out what types of interventions provide you the most bang for your buck. That's where I think like the outcome measures goes. And that's also where like us tracking like return to play mechanisms and like how long somebody spends. And like I think that anybody who works in a team sport needs to make best friends with their strength coach in terms of helping with learning how to track and manage load. And that's load on the field or on the playing surface, but it's also load in the weight room and load in conditioning.
Yep.
Because having norms for that and being able to understand that this is what the most common kind of relative load for a receiver a um, versus a running back versus an O lineman versus a quarterback. Like they're all going to have, because, and I'm using football as an example because it's a really good example of like you have a whole team, but those teams have specialty roles, and those roles, like it or not, that receivers all run off the line and catch the ball. Defensive backs all try to keep them from doing that, and they're practicing for the same game, and so we can group them according to kind of what their function is, right? Same thing with in baseball, we can group outfielders together, we can group middle infielders together, we can group starting pitchers versus relief pitchers together because they have similar roles, they have similar demands, which means that they're going to be trained in a similar way.
Right.
And being able to have the norms for that means that whenever we do have somebody that has to come out from injury, we know kind of the level that they've gone to with like the deconditioning that they get from not playing or not being involved. And then as we get them back to where they need to go, we have an idea of where we need to get them back to. So managing load's a big deal, in my opinion. I think that honestly, like throw away all the manual therapy stuff, throw away so much of the correctives and the FMS and all of these things, and focus on understanding load management and different ways that we can measure things in terms of load management.
Sure.
And we don't have to, it doesn't have to be with Catapult. It doesn't have to be, you know, $1,000 systems. Like it doesn't have to be the fanciest things. Like throw counts and pitch counts, how far someone's running, how many plays someone's in. Like it's not rocket surgery, but measuring that and being able to have that to fall back on whenever we're reconditioning someone is a big, big deal. And I think that also gets into this idea that like I don't know that I would ever expect like an AT working at a 5A school where it's just the two of them to like have so much essay on what those like specific practice loads are. But I'll tell you what, if they came to a coach and asked them about that, that the the coaches that are worth working with, and I know they're all not worth working with, they would be thrilled to death for you to ask them that question. And then whenever you put this in the perspective of I'm trying to help somebody get to the point where they are good with an injury and good with reconditioning and not trying to bring them back too early and get them hurt, like that coaching professionals want to have these conversations. They don't want to have conversations about ice bags and ankle tape jobs.
Right.
And I think that we hurt ourselves by sitting in the training room and not going out and like forming these relationships and understanding how we fit into the ecosystem of the entire like organization, whether that be at a high school or a college or whatever. And so yeah, and that gets into this whole other thing of like, you know, be proactive and like I think we finish school and we show up to our jobs, and this is not an athletic training thing. This is an everybody thing. This is being a young person and being a young professional, and just like the way that we're conditioned and like the way that we're tested and all of that stuff. We show up to jobs, and instead of asking the question of like what can I do to help, we ask the question of, well, it's not really a question. We say, well, this is what I do. As an athletic trainer, I'm responsible for the 5 domains of practice. I'm responsible for prevention and rehabilitation and therapeutic exercise and prevention and other admin stuff, I guess. And instead of asking the question of like, well, here are issues. People are getting hurt. They
Hmm.
seem to be getting hurt towards the end of the season. And then what can we do, or what can you do to help us with that? And then using all of this great knowledge that you got to pass the BOC to apply it rather than just tell people what you do. And whenever they say, well, I don't understand that, and you say, okay, well, I'll be in the training room. It should be a lot more interactive than that, in my opinion.
Sure. Yeah, that was you kind of hinted at it a little bit, and I just wanted to kind of summarize on that. Just the story and everything else, the context, like you had mentioned earlier, that goes along with the data and who you're talking to, and why that's important if you're wanting to implement more of these things, coming with some of the data, but then also having that story behind it of why this actually makes sense and not just, hey, here's a bunch of data, here's exactly what we did. Instead, even make that argument on some of those other things is just we know secondary school ATs are busy in their athletic training facility. Like that's
Yeah,
not, I don't think that's surprising to a lot of people. And if it were
yeah,
just the numbers that showed patient interactions, things like that, there would have been a shift. Either A, you're getting paid more, or B, you're getting help, or whatever it is.
yeah, yeah,
Speaking from my own experience as well, when we were, keeping track of some of that simple stuff at the university I worked at, but that didn't really move the needle.
yeah,
It just wasn't. That's great. Like everybody's got those numbers. Everybody's high, and so figuring out
yeah,
the story to tell behind it and pulling those things and really like that's where you can start pulling people more in and then having the meeting
Yeah.
is so important.
And I I really don't want to give off the impression that I'm not sensitive to that. And I'm not sensitive to the idea that like ultimately we work for ADs. And a lot of those ADs are old coaches who were raised a certain way. And um, it's not anybody's fault that whenever, Coach Bill or whoever who has, he graduated from college in the mid 80s. And whenever he was in school and doing whatever sports he was doing and coming out and as a young coach, the athletic trainer was someone who their educational requirement was that they got a PE degree and then they took like an A&P class and learned how to tape an ankle and did an internship. And I know I'm sounding really, really harsh when I say that, but you look at the like you look at the stuff that people were talking about and what was important in like the infancy of our profession, and you look at how we are like our standards that we hold ourselves to in terms of our education and in terms of our continuing education now, at that point we were very much technicians, and at this point we are medical professionals, and you have to fight that previous kind of perception of us from back in the day, a lot.
Yep.
But I also would say that just, my removed perspective is that the only way, I've seen this just within the special operations community, and I've seen this within professional sports as well, and I think you're starting to see it in college sports, is that the more people that we positively impact who then grow up to become the ones who are making those decisions, who remember how great of an experience they had with their athletic trainer and really what it took to take care of them, and have the perspective of we really need to take care of those people because they are taking care of us. That needle has moved and will continue to move in a positive direction. I don't know what to say to someone who's dealing with um, the others, or like, the that kind of old school mentality, other than that you are not a tree and you don't have to stay in any one place if you don't want to, and
Sure.
that the market is going to correct itself. I don't know how quick it's going to take, and I think that our friends in college athletics, who are really, really hurting right now because you can't beg, borrow, or steal somebody into a lower level job. And I say lower level, I shouldn't say that. I say an entry level job at a college.
Yep.
Like whenever it's being said that, like, and just think about it, like as a new grad coming out of a master's program today, if I'm looking at entry level jobs and there's one being offered at insert big name Power 5 school, no, not even Power 5, Group of 5, Division 2, whatever, and those jobs are being offered, and you're making 45 grand to, which is the profession average, which how sad is that? But you're making 45 grand to work 80 hours a week. And in today's collegiate setting where there is no off season, or today's collegiate setting where most schools, if you're not working football or basketball, these entry level jobs, they're responsible for at least two sports. And like you're going to a place where, like, from a safety standpoint, are we really providing enough bodies to like make sure nobody's dying? Depends on what metric you're using, like that sort of thing. Like, and the expectation is you're going to work 80 hours a week, you're going to make 45 grand a year, and you're going to be solely responsible for two teams, and they're going to call you at 3 a.m. And like, if you don't like it, then, maybe you weren't cut out for this profession. Um, and you have that, or you can go work at Amazon in an entry level position and work 40 hours a week and make 70 grand a year. Like, where do you think they're going to go?
Right.
And as the applicant pool is shrinking, which to be clear is not a bad thing, as the applicant pool shrinks because of this master stuff, and as more and more emerging settings are realizing the value of an AT, and they're putting a good dollar amount on that value because they know that our presence is better than our absence in terms of moving the needle in the occupational setting, in the military, in the performing arts settings. As that continues to happen, college athletics and really traditional athletics in general, college and high school, pro sports is a little different, but that's because of the
Sure.
prestige thing. But those two specifically, like their labor pool's being just drained, and it's being drained because they have better options. And so at some point the market will correct itself. At some point people are going to be like, hey, I wonder if maybe we paid these guys more and we restructured things to make it to where they wanted to show up if they'd come. That will happen, but it's just taken a lot longer. And um, having so whenever I was waiting to get this job, I interviewed at a Division I school in my home state, and and uh, they said they really liked me. We had a good discussion. I know a lot of people there because I'm from there, whatever. Um, on paper, the position description, the max that I could make as a football athletic trainer at this Power Five, let's one Power Five at this Group of Five school working football was 48 grand. And I told them I have 10 years experience. Absolutely not. I said I won't even entertain a conversation unless I'm making at least 65. And the response was, well, that's what the head football person makes. And I said, okay, well, you need to pay them more. And then if you want to talk to me, we can talk about it if it's at least 65. And um, the response I got was the next day, I got a text that said they're wanting to know if you can do it for 55. And I said, no, I'm sorry. And then that was the end of that.
Sure.
And that's just my experience in this job market. And I jumped in and took interviews and got job offers in the physician's practice setting. And the percentage of places that paid above 60 was pretty high. The percentage of places that paid 70 or above was not as high, but they still existed. And that's in the physician's practice setting. And then it's also going to depend on where you're at too, right?
Sure.
Like, we know that a secondary school in Texas, like you can go down there and be an entry level athletic trainer and make 60 grand first thing versus like whenever I was in New York, those jobs, you'd be lucky to get them to pay you to pay you 60, and that's living in New York.
Right.
Um, so it's I don't know what to do about that other than just continue to pound the rock. And eventually, the people who make those types of decisions, like they're either going to be pressured by litigation and the lack of people, and the needle's going to get moved where they're going to increase salaries and they're going to like change the way that they kind of expect people to do their jobs, or they're going to kill somebody. And that's like some of the biggest drivers of change in our profession, and particularly in college athletics, have come from litigation. So it could be that too.
Fair
And
enough.
nobody wants that, but that's probably, I mean, look at Maryland, look at Rice with the sickle cell guy. Like you can go back and look at all that stuff. I mean, it's the same reason why in military training environments, everybody's required to have cold tubs everywhere all the time because they were killing kids with exercise into or the exertional heat stuff.
Yep.
So like sometimes that's what drives change. Anyway, that's like way far away from what you were asking about, but it's a worthy discussion, right?
Absolutely. We may have to save that one for another episode. Just kind of in the interest of time, I think we'll jump into these AT chat questions.
Okay.
You may have actually kind of just answered this one, so I'll see if you have anything else to expand upon it. Is where do you see the athletic training profession going in the next 5 to 10 years?
Um, so
And if you want to say, I just refer to what I just said, I can
well,
get you there.
you can refer to that, but I think I just don't know because I think there are fundamental changes that need to be made in terms of how we advocate for ourselves. And I think that the people who are being put in charge of advocating for us are spending a lot of time talking about things that they don't need to be talking about, like name changes and stuff like that. Um, and so I don't know. let me just give you my best perspective on this, and it's not a good one, is that I will never work as an athletic trainer ever again. And all of my friends who I respect the most have also gotten out and will never work as athletic trainers.
That's fair.
Um, and so I mean, uh, that sounds real doom and gloom. And I want people to succeed, but it's like the overall, like the nature of the market and the nature of college athletics and like the places where we're supposed to be like the experts and like really, get our money, people get their money's worth out of us. Those places are being shuttered and they're like they can't buy, beg, borrow, or steal staff, and they're all going to these other professions or these other areas of the profession, or they're just straight up leaving. And I think that's, I mean, unless we figure out a way to address that and address the fact that among public universities, 3% of their budgets are being spent on athlete wellness, like, unless we can get into that, I don't have good feelings. Which, oof, I'm glad I have a bulletproof vest. I can't wait to hear about how I'm wrong. Um,
What advice did you go back and give yourself as a young athletic trainer? And if you could, say when that would be, in your career.
yeah. I would say, and this goes back to like probably one of my first jobs, so like pretty young. I would say that um, you shouldn't look for what makes the people around you happy to make you happy. You need to go after what makes you happy. I think I spent a lot of my time as a young person trying to get to a job that I saw other people getting joy from, and I saw other people really getting a lot out of, that wasn't a job that I liked to do.
Sure.
And um and I spent my time really trying to emulate people who I really, really admired, um, instead of like asking myself like what is going to help me be able to look myself in the mirror at the end of the day and say you did a good job. So we put a lot of our focus externally, and we put a lot of focus on like trying to sort of do the things that we saw people do whenever we were in school or whenever we were growing up. Like, I want to be the head athletic trainer at whatever D1 school, or I want to be the director of sports medicine for whatever professional team. And that's fine if the stars align to get you there. But at the end of the day, you have to go home, and you have to, like, everybody either dies or quits or gets fired from a job. Nothing lasts forever in the professional realm. So you have to be able to take care of yourself outside of that. So make your decisions to do that.
Makes sense. What has been the most influential resource you found in your career?
A resource, I mean, the internet, right? Uh, I don't really know the scale of this question. Um, I think that the biggest thing that's helped me is learning how to, um, like, read and interpret research and
Sure.
understand what was, like, what were they trying to answer? How were they trying to answer it? Did they even answer it? And
Right.
like being able to take things and put them in the scale of like, it's kind of like a what have you done for me lately sort of thing.
Yep.
Because if you don't know how to drive the questions that you're asking, you can really get lost and find a lot of disparate stuff, and you can end up more confused than how you started. So for me, being able to understand how to read research and how to apply the results of the research that I read has been a big deal. And that's not just in like the athletic training world, that's in just like my entire scope of like,
Oh, I can
you know,
imagine.
doing the things that I get to do.
Yep, that is one I have definitely learned as well, as I've gotten further into my career. As an AT in your role slash non-AT currently, how do you take care of yourself?
Um, so like self-care is a big deal to me. And I would say that whatever kind of routine you put together, think of it as like a meal with separate ingredients. And so even if you were missing one ingredient, it doesn't ruin the meal, but you can taste the difference between it. So like, how do I take care of myself? I really, really pay attention to my sleep. I pay attention to my nutrition. So what am I eating? When am I eating it? Um, Something that I recently discovered for myself has been, and it's funny, like, the whole thing about people, we're healthcare professionals, but we don't take care of our own health. Like, I didn't have a good understanding of how exercise affects my mental health until like within the last year. And so
Sure.
for me, having some form of structured, regimented exercise that I practice in some way, whether it be strength training or some form of conditioning or something, and it's something that I can go to that's outside of my like work and life, and that it's something that I do on a continuous enough basis that I can track progress in some way, like that is a big deal. So that's a really big part of how I take care of myself. Um, it's I'm not going to tell anybody anything that they shouldn't already have a good understanding of, at least like on a fundamental level. Like be around people you like being around, do things you like to do, sleep, eat, and like don't stress about stuff, and that's how you take care of yourself. And I wish it were that easy to do as it is for me to have just said that, but that's,
Right.
I mean, that's what you do.
Yep. Yep. I understand that. Well, I'm going to ask you to pick just one thing on this one. If you could change or eliminate one thing, could be a modality, common practice, mindset within the profession of athletic training, what would it be?
I think it would be this idea that, because I see this a lot with not just young professionals, but like a lot of other people too. I think this mindset of like I've passed the BOC, therefore I've made it professionally, and not
I've been
kind of,
there. I learned that lesson quickly.
well, and just not being uh continuing to be curious and continuing to try to make things better and continuing to try to learn and to position yourself around people who bring the most out of you. Like if you finish school and you get your job and you're just like, yep, I got my BOC and I do my continuing ed, and I still do the same things that they taught me how to do whenever I went to da 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 school, and I do a really good job at that. And like if you ever are ever in a place where you feel like you don't have anything else to learn, you probably don't need to be in that profession,
Sure.
regardless of what that is. And maybe that's just like a me thing, but I just um I I think that having a fixed mindset about things, it really sets you up for long term, like it sets you up for whenever bad things happen, you don't know what to do, and it can create like a lot of hardship in your life. If you are setting a like a growth mindset with things and you're always trying to get better, and you also have the self-awareness to know that like it's like the I'm not okay, you're not okay, but it's okay sort of thing. Like if you have the self-awareness to know that you have a ways to go, but you're doing what you can to get there, like it's just it creates so much self-efficacy, and it kind of takes away a lot of like if you put so much of yourself into just like the place that you are right now and like your one job or your one profession and things that like really aren't in your control in a lot of ways, um, and then that is taken away from you because you don't have any control over it. Speaking as someone who was fired from a job one time, where I put I mean, just so much of myself into being the best that I could in that profession or in that position. And then it was one of those things where a series of events and stuff that I couldn't really control. And suddenly I found myself where it's like, well, you're being terminated and, sorry about it. And it sucks, but I also feel like it is something that has put me in the best position possible because I don't put my self-worth into what I do. I put my
Hmm.
self-worth into the person that I am. And that, I mean, it's a big deal. So anyway, if I could eliminate one thing, it would be, well, the one thing would probably be what don't think that what got you here is what's going to keep you here.
I like that
And
one.
it's definitely not going to get you there.
Right.
You know what I
No, I
mean?
like that a lot. I like that a lot. Last question. we'll let you go with this one. Is what does being an athletic trainer or having been an athletic trainer, as you mentioned, mean to you?
Um, for me, it means it. It's always been I have this really cool and like athletic trainers in general are to me like we talk about being the Swiss Army knives of healthcare of or of the like athletic realm.
Mm-hmm.
To me, what I've always loved about being an athletic trainer is that I got to live in so many different spheres or in so many different like parts of these industries. Like I can have a conversation with a performance coach. I can have a conversation with a sports fan. I can have a conversation with an athlete. I can have a conversation with the people in the front office. And to be able to have the essay and the expertise to contribute to so many different conversations in a meaningful way, that's what drew me to the profession. And that's to me like that's like to be able to have this whole like medical expertise thing going on, but also like I still like I understand what sport I'm working with in a way that most other fans don't,
Sure.
but I also understand the development side of it, but I also understand the fiduciary side of it, but also like I love sports, like being able to be well represented in so many different ways and in so many conversations to me is like the coolest part. um, and I still would consider myself somebody who gets to do that, just in a little different way, because I'm not practicing, I'm not putting hands on people, but I am empowering the people who do put hands on people to do their jobs the
For
best that
sure.
they can. And my favorite thing about what I get to do now is that I get to take my perspective and represent the people who are just like killing themselves trying to do the best job possible. I get to represent that value to really important people,
That's
and I feel
awesome.
very grateful that I get to close the loop like that. It's just to me, it's just like the coolest thing.
No, that's a really cool way to look at it and really impactful. In closing, if people wanted to connect with you, follow you, if they got questions about uh, data science, data analytics, I know I've messaged you a few times and probably will
And
continue.
and I owe you some resources. I know. I'm sorry. It's like
It's not like I've got time to do them right now anyway, so I'm not stressed about it.
yeah, we're
So,
all we're all in this boat. Like and like I asked my like one of my government counterparts the other day who's been in this position a lot longer than me. I'm like, is there like, I'm from a background where there's like seasons. There's it gets high and then it goes low and like we're super busy, but then like we're not so busy. Like, is there a season to this? And he just looks at me and he's like, no, Lyle, it's busy and then it's really busy. And those are the two speeds. So
fair
I get
enough.
it. Like that's part of it. Yeah.
But if people wanted to
But
connect with you, where would be the best
yeah,
place for them to do that?
you can message me on Twitter. It's the data driven AT. Um, really, that's probably the best way.
Perfect.
Um, and because that's it's on my phone and I check it. Instagram, I kind of am a little more closed hold on that stuff, and then Facebook again, I'm pretty closed hold on that stuff. So
Sounds good.
if they want, they can email me too. My email is my name, lyledanleyatc@gmail.com.
Perfect.
Happy to field questions there too. But yeah, that's probably the two easiest ways.
Awesome. Well, I'm glad we finally got to do this, connect in
Yeah,
somewhat person. And I have a feeling we'll do a follow up at some point on a variety of topics again, but it'll be good.
that's I love to talk. So if you want to talk, we can continue doing that for
Sounds
sure.
good to me. Well, I appreciate you being on, and we'll look forward to the next time.
I appreciate it. Thanks so much for having me.
Thank you for listening to this episode of Athletic Training Chat with Lyle Danley. I hope you got some ideas for data and how to break it down and the importance of what you're doing and telling with that data and really how that can impact beyond just showing the numbers. Obviously, we think that's important and something that really should pay attention to. If you have any interest in getting into journaling, check out the Athletic Training Daily Journal available on Amazon. It's 366 days of prompts, cues, questions, quotes, focused around many different aspects that are directly related to the athletic training profession to help you grow as a professional and maybe as a person as well. If you want to give it a try and see what it's all about, head over to clinicallypress.org/shop and you can find the 14-day downloadable trial for free, just to see what it's all about and if that's something that you would ultimately be interested in. As always, we want to thank Mueller Sports Medicine for helping power this podcast. Check them out for all your sports medicine needs, especially as everybody is getting into the thick of everything this year. They'll be happy to help you out, and if you've got ideas, let them know as well. Until next time, thank you for listening.